Hi, everyone. Welcome to another edition of Talking Away The Taboo. I am Dr. Aimee Baron, and tonight we are having a really important story about a hysterectomy. But really, the story is about a woman who has been through so much that she needed at the end of the day for her own sanity, for her peace of mind, because she couldn't take it anymore. She ended up, we are in the midst of a week that is devoted to Yesh Tikva's Infertility Awareness Shabbat. And Chaya Kasten, who she and I had a chance to speak a couple of weeks ago, and she was saying, I really feel passionately about sharing my story. And I said, I think that this week could be a really wonderful week to share it. And she said, but like infertility, like what are you talking about? Like, and I said, there are so many different reasons why people aren't able to have the family that they dream of, and being unable to carry a pregnancy is also one of them. And so here we are, and I'm so honored that Chaya, for the first time, is sharing her story here tonight. So say hello to everybody.
Hi.
Chaya, give everyone just a little bit of a window into, like, before we get into your story, just like who you are, your background, where you're from, a little bit about your family, what career you're in. Just tell people, center people, tell them a little bit about who you are.
Okay, so I grew up in a very yeshivish family. I grew up in Telz Yeshiva, like on the Telz Yeshiva campus in Cleveland, Ohio. I am the oldest girl of 9. I have one older brother. And as far back as I can remember, like probably around from the age 13, I was kind of fascinated by like the medical field, by nursing, by, you know, one of like my role models is Florence Nightingale and Schwester Selma. But I never actually thought like I would go like as much as I wanted to do nursing or midwife midwifery was my like real passion, I should say. I never thought it would actually happen because I never, like I was like, okay, but who does that? Like when I was 13, there were no from like yeshivish girls going into nursing. And then when I finished seminary, my mother actually looked into different nursing programs, and it just wasn't relevant at that
Okay.
time. When I was 20, my parents made aliyah, and I was not ready to be on my own. So I said, okay, I guess I'm coming with you guys. And when you make aliyah, the Israel, I don't know if it's still like that because it's been ages, but they pay for schooling. So I said, okay, let me take advantage and actually go to nursing school.
Wow.
And that's what I did. And I'm still really, really passionate about women's health. Right now, I mean, it's not just, it was a lot of hard work and effort, but I'm just a registered nurse. Like I haven't gone
Just,
further. Right.
just.
Um, I haven't gone further yet, but my goal is to become a nurse practitioner in women's health and midwifery. And people are like, go do it. I said, I will. It's just, it's not off the table. It's not like I'm like, okay, I'm done. It's just a matter of when it will work for me to go back to school.
And if I remember correctly, you are also a bodeket. Is that right? Okay.
Yes, that is right.
Okay,
That
so
was the
just
first.
tell people what a bodeket is, because maybe there are
Okay.
some people in the audience who don't know.
Okay. A bodeket is Usually a nurse. I know there are some who are not actually a nurse, but usually a nurse who women go to if they have like a question um, in the laws of family purity where they're bleeding or staining and they're not sure that it's actually coming from the uterus because only blood that is coming from the uterus is actually a problem. So if I check and I see it's coming from a wound somewhere at the center of the cervix or there's some sort of something, then it's not a problem. But you have to have someone who's considered reliable in terms of Jewish religion um, to check that.
Right, right. So sometimes if you don't have a bodega in your neighborhood, in your city, you know, I've been sent sometimes to my doctor because doctors also can check, or a midwife or someone like that. But
Yeah.
if you have someone like you who's also trained as a bodega, then that person can also look. And I thought it was important before we get into your story, which we're going to start in 1 second here, that people know that you are a woman who has been trained in the medical world, and so everything that you have experienced is not is you are so a person who is really in tune with women's health in general, but also you're a person who's in tune with your own body, and so everything that you're going to hear about tonight, like yes, of course that every person knows their own body best, and you know when things are working and when things are not working, and when you're in pain and when you're not in pain. You know your body best. But what I think makes Kaya's story even more powerful is that she's also trained in the medical world, and so how much more so what she has gone through and the decisions that she has made, I think, are just even more powerful and even more poignant. So I think we've teased enough. So Chaya, let's sort of launch into this. Tell us, okay, so you met your husband. I
Maybe
guess
the
actually, but hold
story.
on. Let's where does this story begin? Let's go there
Well, I
first.
guess it should begin at the start of puberty. Like I've always had really long, heavy periods, which caused me to be anemic. I was, always doing blood work, checking and taking iron on and off. But I didn't have any crazy cramps. Like I would say probably like took like literally I can count on one hand how many times I would take something for period cramps. Like like Baruch Hashem, that was like a blessing that I didn't have. Not only was I not um a crazy amount of pain, but I was barely in pain at all. So but it was always really, long and heavy. And before I got married, my mother, like, when I entered the dating world, my mother's like, yeah, you should really take care of that at some point before you get married. But that was that. Um, so then I met my husband, um, and we got married, and I got pregnant right away. And honestly, that was kind of, I don't know why, being in, I should, there, logically, there shouldn't have been a reason for me to think this because I was always very, very regular, but I was convinced that it would take me time to get pregnant. Like I was, so the, so I didn't even think about going on birth control after I was married. I was in the last year of nursing school. Um, and I got pregnant right away, and it was a hard pregnancy. You know, I had HG, which is extreme morning sickness. Um, I actually remember I hit 5 weeks of pregnancy and I was feeling fine. And I was like, okay, I'm just going to be one of those women who just don't suffer from nausea, um, or throwing up. And then I hit 6 weeks and the nausea just came on like a light switch and it didn't leave the entire
Oh gosh.
pregnancy. Um, the doctors called it mild HG. And I'm like, if this is mild, I can't imagine what people go through. And it was really, really difficult. Like I was newly married, discovering that, and then also newly pregnant and barely able to function to the point that I would tell my husband like every single night, like trigger warning for anyone out there, but go grab the sharpest kitchen knife and just kill me because I
Oh,
can't live with this.
oh my God.
And I was also just crying all the time for no reason. And I just thought this was pregnancy. This is what pregnancy was. It's just, hormones. And then I had my baby and I felt amazing. I was on top of the world. I felt so good to the point that like I was ready to go out like a couple days postpartum and my mother's like you have to stay at home and I'm like but I feel so good. Um and I was fine. I would say probably for the first couple months, maybe around 3 months. And then slowly but surely, um, my depression that nobody realized that was going through during pregnancy came back. Um,
I was actually just going to ask you about that and say, like, did people make the assumption that you were having those really strong emotions of like, really like suicidal type emotions? Like, were people
I
were
didn't tell
you didn't
anybody.
tell anyone, and so even your doctors didn't know that's what you were
No,
feeling.
no. Because I just thought, because it was just so bad, it was situational. I didn't even realize. But I do remember, because I'm in the nursing field and because I was aware, I remember telling my husband before I gave birth that if he sees I'm neglecting the baby, he needs to get help because I knew postpartum
Right.
depression exists. Um, but it didn't hit all at once. I would say it was more gradual. And I didn't realize it was postpartum depression until like it got so bad that I wasn't just like, okay, suicidal. This was around 8 months postpartum. I was actually planning my suicide. Like I had a plan and everything.
Oh my goodness.
Um, and the reason why nobody realized was because I wasn't neglecting my baby was the only one that was getting taken care of. I was neglecting myself. I was neglecting my husband. I wasn't really functioning. I would literally, the only time I would function was when I would go to work and come home. Um, and then I was literally in bed. And my husband didn't realize because he was out of the house most of the day. So it wasn't like he saw what was going on. And also, I don't think he really knew me that well. He didn't know, like, even if he would have seen me, would he have realized this is not, this is not the girl I married? I don't know. We went from being like newlyweds to me being pregnant and awful, um, to being new parent.
Right.
Um, and I do remember him making a comment where he said, "Oh, I wish you would stop neglecting me," because he had heard that new mothers, especially the first one, because they're adjusting to motherhood, a lot of times they neglect their husbands. They focus on the baby, they focus on themselves. So he thought that's what it was. He didn't realize until the point where I was like, okay, I'm done. Everybody would be better off without me. I can't live anymore. And I told my mother, I think I'm suffering from postpartum depression. And she was like, no, I like she like brushed it off. She's like, what do you mean? You're functioning. Like, because she knew I was going to work until she saw like at the very, very like last few days where I was, not okay. Um, and once she realized that, and I realized that, and we all realized that, I went to get help. I first called up, I can't remember the name of the organization, but it's in Israel specifically for
Okay.
postpartum women. And I called them up, and they basically helped me realize that the main trigger that was causing it was the birth control pills that I was on. I was on the mini pill. Um, so as soon as that happened, I made a doctor's appointment, and he took me off and gave me an alternative. Um,
And
I
and
think.
and did that help?
It helped, yes. I always say I'm so surprised like that I wasn't hospitalized, but in Israel, they're not very, they do what they can to not hospitalize you, even if you're actively suicidal.
Okay, we're not gonna debate the merits of that
Um,
merits or not non-merits of that piece at the moment, but
Yeah.
because you're here now, so we know that you made it through that period. But I guess
I
at that,
just wanted
yeah, go
to
ahead, go ahead.
say something. My doctor was my next door neighbor. So, like literally it wasn't like he was just like, you know, taking me off of the
Yeah,
birth control and saying like, this was my regular doctor. I ended up going to my gynecologist and she put in a non-hormonal IUD, a copper IUD. And a few weeks later, I actually worked with her at that point.
as
So when I was
as a
working with
nurse, as a nurse.
as a nurse, yeah, I was working along, like I was one of her nurses at one of the places she was working. So I mentioned to her, I said, I don't feel the string anymore. She's like, okay, let's do a quick ultrasound. And she's like, I don't see it. Go do an x-ray so we can make sure it hasn't gone into the abdominal cavity. I did an x-ray and it was gone. Like it was, there was nothing there. So she's like, okay, make an appointment. We'll put another one in um, after I was sure I wasn't
Right.
pregnant. Um, so I got another one put in, and it was the same story a few weeks later.
So wild. That's so wild.
Yeah. So she's
That
like,
you
stop.
put in IUDs and they just kept falling out.
Yeah. So she was basically like, okay, obviously your anatomy is not, you know, she was like, I'm not putting another one in. This is crazy. And I went on the NuvaRing at that point because it's not, it's not going through my entire system. And Baruch Hashem, I was pretty much okay on that.
And
Um,
so, and so just to go back for a second, like the, this experience of you having postpartum depression, there was never a link that anyone said like during from that to the feelings that you had while you were pregnant also with the severe HD. Like, did anyone say, you know, maybe this is, connected, or they just like made the assumption it's totally different. Let's just treat this and sort of not think about it anymore.
I don't know if it even came up the feelings that I was having during pregnancy. I only realized that what I had been suffering from the first pregnancy, like all those feelings, were what they call antepartum depression when I got pregnant with my second, and I was not feeling those
Got
feelings.
it. Got it. Okay. And can you talk about like, I mean, the way you're describing it now, you're like, okay, well, I stopped taking the pill and then I, tried the copper IUD and blah blah blah. Now I'm on the new ring. But like, when did you start feeling better? Like, and were you in therapy also at the time? Like, what was, how
So I
how how was
did,
your day to day?
okay. So I did start therapy, but there was still like the major stigma, and I was not really, I don't think the therapy helped. I don't think I was open really to therapy at that point. Like I wasn't so comfortable in general. And so I went to therapy for a year, but I don't think I made progress. Um,
Okay,
it was kind of like maybe a little bit of a band-aid. In terms of feeling better, within like a few days, I already started feeling somewhat better, and it got better as time went on. My guess is that there was probably some like very like under the skin kind of depression that I didn't realize what was going on. Like now that I'm thinking about it, like I don't think I ever fully went back to myself in that period of time.
got it, got it. Okay. I mean, I'm just hearing you talk about it now, and it's just I'm so grateful that you're being so open for so many people who may be going through this and really struggling. I guess like talk to us about like, what happened next. So you were starting to feel better. You found a method of birth control, the NuvaRing, that it was a hormonal birth control, but because it was localized, like it did work
It
for
was,
you.
it did work.
Um,
I probably did have some like mood, like it probably did affect my mood, but not in a way that I was like, okay, I'm done with living. And everybody would be better off without
thank
me.
God. Thank God. So what happened next?
So, around 18, when my daughter was 18 months old, we basically decided, okay, because everybody had been telling me, oh, the first pregnancy is always the worst. The second one will be fine. You'll be okay. Like, should be okay. So at 18 months, when she was 18 months, we're like, okay, we think we're ready, even though part of me kept saying, like, I would be totally okay if she remains an only child for the rest of her life. Like, but it was mixed feelings. Like I was somewhat ready. Like I was like, not that I was ready, but I was okay enough with and all I can say is that it took about 6 months to get pregnant, which I was actually relieved that it didn't happen right
Yeah.
away. Just till like my periods like really like got back to normal. Um and I got pregnant, and this time pretty much as soon as I got a positive pregnancy test, the HG kicked in. Like
Wow.
it didn't wait at all. And it was different than the first one, because with my first pregnancy, I would wake up and feel okay enough for like the first hour or two. And I would be able to eat like one meal that would not stay down. But the second one, it was so intense. It was morning till night. And I had a toddler that I was taking care of, and she didn't understand why all of a sudden she can't come into mommy's bed, because anyone who would breathe near me would trigger, the nausea and the throwing up. I was a little bit more prepared the second time around, so I did get fluids every other day.
Wow.
Um, yeah, while I was at work,
Wow.
actually, usually.
Wow.
Um, yeah. And there's people who like try and like not talk about the fact that they're pregnant for the first trimester until they hit the second trimester. It wasn't even an option for me. There was no way I could hide it from pretty much anybody.
Right.
Um, I do remember feeling a lot of anxiety during this pregnancy as well. Like I had anxiety in the first one, but I also had anxiety in the second one about the baby not being healthy, or I was like, I felt like I couldn't take a breath until she was actually born, and I saw her 10 fingers and 10 toes and everything was okay. Even though the scans all showed everything was okay, I just couldn't
And
relax.
were you having any feelings of depression also, or it was
No,
more like it was, the severe nausea and vomiting, the severe hyperemesis gravidarum, that HG, and it was also like this anxiety, but the depression piece,
right.
the sadness, the suicidal piece never came up.
No. And also the it only lasted more or less the first
Got it.
trimester. Like it wasn't as long as the first time
Okay.
around. Like I
Okay.
was, I hit the second trimester and already started feeling like slightly better every single day. It wasn't like with my first one, it was the same until 20 weeks and it never went fully away.
And so that when your baby was born, what happened afterwards?
So I did have a bit of a more complicated delivery than the first time. Um, I had they're calling it retained placenta. I actually don't think it was placenta. From what it looked like to me was umbilical cord. Um, my theory is that it was actually started off as a twin pregnancy but never fully developed. Like when I did blood work, my progesterone was like sky high even before the actual pregnancy was positive. Um, And, when I showed it to the gynecologist that I was working with, they're like, oh, you're probably pregnant, like, because I was like, what,
Yeah.
Um, and the first ultrasound that I did, and because I knew, I literally found out that I was pregnant the first second you could find out. Like my, I don't know what the values are here in America, but in Israel it was like above 25 you're pregnant, and
Okay.
mine was like 30,
Okay.
literally. Like that was, to the point that they were like, why is it so low? And I'm like, you know, they had me repeat blood work every couple of days just to make sure. I knew it was fine, but um so I did the first scan right around 6 weeks. Like my gynecologist had to tell me, don't schedule it before 6 weeks because they're probably not going to find a heartbeat and then you're going to panic. Um so I did it at exactly 6 weeks, and they saw something besides the regular pregnancy sac, but they weren't sure exactly what it was. And they said either you'll bleed it out or you'll absorb it. And I just absorb like nothing happened.
Right.
And then after I gave birth, for like I was having more bleeding than normal, but I didn't know that it was more than what it was supposed to be because I've always had heavy bleeding. But I remember thinking like, how are women in the hospital in their own like own robes or whatever? My like I didn't realize. And then when the doctors checked me, everything was fine. So like until a week later when I had like insanely heavy bleeding, um and then I woke up in the middle of the night having like not real strong contractions, but like contractions. And I went to the toilet and there was this long white twisted cord, probably about a foot
Oh my
long,
gosh.
that came out. Um, and so I ended up having an infection as well. Um, like, and an infection and mastitis as well. Because up until that week, that first week, my milk didn't come in, but I didn't realize it. I thought it was just because it was my second. So that's, you don't have that overflow of milk. Um, so the first, it was a difficult recovery, first month. And she was a very, very difficult baby to the point that like 5 weeks, I turned to my husband. She didn't sleep. She just screamed
Oh God.
and didn't
Oh
sleep.
God.
And 5 weeks, I told my husband to find somebody else to adopt her and take care of her. I can't do this anymore. It's either me or her. Um, yeah, we ended up taking her to craniosacral therapy, which is like similar to, I would say, like a chiropractor. Um, and it made a world of a difference. We literally had like at 3 months, people were like, "You have the calmest baby ever. What did you do?"
Wow. Wow.
Um, yeah, like that was like the turning point.
Yeah.
Um, yeah,
But okay, so what happened with you? I mean, you have this like traumatic delivery and like with lots of bleeding, you have this like postpartum infection and also like, tremendously heavy bleeding and expelling, more products, whatever that is. Um, I mean, what like then what? I mean, because I know the end of your story here. The end of your
right.
story, well, we all know the end of the story because of the title of
So,
this talk.
yeah.
But like
So
take us
before I
through
even,
take us through
okay,
what happens next.
so before I even gave birth, like I was still pregnant, I had already started discussing birth control options with my gynecologist. And she was the one, like I had been with her throughout, not throughout the entire first pregnancy, but like at least half of the first, like my first gynecologist was awful and I switched to this one who was, amazing. So she knew my history. Like she was the one who had, and so I was already discussing options before I even gave birth because I was like, I'm done. I can't do another one. I can't do another pregnancy anytime soon. And all I can say is thank goodness I lived in Israel and not in America because there are more options in America. There's this other non-hormonal IUD that they have in Israel that they don't have here in America. And it's a different shape, and it doesn't just like sit in the uterus, it actually attaches to it like so um but it's also a lot more expensive, and there's only like 2 doctors or 3 doctors in all of Israel who actually know how to put this specific one in. So, but it wasn't like I had an option in the matter. So I already like had a clear direction of where I was going, and I got that put in, I think 8 weeks postpartum.
Okay.
I think like I don't think they did it at 6 weeks. I think it was 8 weeks postpartum. And it was great for the first, I'm trying to think, for the first few years. Like, it stayed in place. It wasn't an issue. It didn't cause a crazy amount of bleeding any more than my, naturally I would have. And then it was fine. Um, and so my daughter was born in 2017, in Israel. And then in 2019, we moved back to the States. This was July
Okay.
2019. And there was the adjustment period, and I had trained as a nurse in Israel and worked there, but I had to do my boards in America. So there was the stress of the finances and, adjusting, but nothing like crazy. I was, you know, everything was like, I got to be home that summer with my kids, which was amazing. Um, and then of course, and I got my American nursing license in February 2020,
Okay.
literally right before the
Right.
world
Right.
shut down. Um,
I can I
and
can I actually stop you just for a second? At
yeah,
that point your children were how old? Let's like by February
um,
2020-ish.
so they were my younger one was almost um almost 4. And my older one was they're like just like short of 3 years apart.
Okay.
So it was like 4 and 7.
Okay.
Like,
And was anyone at that time talking to you or saying like, "New, when are you going to have another? What's happening? Are they going to be your only children?" Or like, or or like the people who knew about your experiences with both pregnancies and what happened afterwards, they were like, "We know that this is hard for you, and like we don't like we respect your decision, and we're like we know that it's just too much for you."
it wasn't really even talked about. Like it wasn't, other than between me and my husband, it wasn't talked about. I do know, thinking, I actually did have, like, right before we moved, I did get a positive pregnancy test, a positive home pregnancy test, and I actually panicked about it, and I was like, I can't do this. I do remember going through times where I was like, if I were to get pregnant, a non-planned pregnancy, I would have to have an abortion because I can't go through a pregnancy. So that one positive, I'm pretty like the doctors can't give it a name because it was only a positive home
Yep.
pregnancy test, but it was pretty much like a chemical pregnancy.
Yep.
And I was actually so grateful, like that like it didn't really even go anywhere. I was literally like, thank you, Hashem. I don't think I could have had um just a pregnancy in general, but when you have an IUD, it's considered high risk.
Yep.
And moving back to America and dealing with all of that I was like, I thought I'm like, I don't know what I'm gonna do, but thank goodness it was a
Yep.
chemical
Thank
pregnancy.
goodness.
Um,
Thank goodness.
yeah.
But you weren't getting any pressure from anyone at that point.
No. People who knew me and knew how hard my pregnancies were, and the like I didn't suffer from I did have I would say struggles with mental health, but it wasn't postpartum related. There were just different stuff that was going on with my family, and I was just like, it wasn't pregnancy related or whatever,
Yep.
postpartum
Yep.
related.
Okay.
Um, so then I got my nursing license, and because the world shut down, I didn't start working at that point. I was just at home. Originally I thought it would just, COVID would be nothing. Like didn't really understand the severity. But once I did, I think I'm probably one of the only people who realized that once it went past like that 2 week and that month and whatever, that like someone's like, oh, after COVID. And I'm like, there's not going to be an after COVID. This is here. We're going to just have to learn to live with it. I don't think, so I did realize that. But I did start, you know, suffering from severe anxiety. And I went through, I was like on Instagram and was, I was pretty anxious in general. I don't know if it was just being at home all the time with my kids or what the situation was going to be like or not being able to start working or I don't know what it was, but I started suffering from severe anxiety. And then I was on Instagram and I saw someone talking about this phobia. And because of the way I am, like anytime I see a phobia, I go and look it up and see what it is and what, how it affects people and whatever. This was, it was called trypophobia. I've never heard of it before. And um, I went to look it up, and it's I don't want to go too much into it because it is, even when I talk about it, it's triggering, but it's fear or disgust of irregular spaces or holes, like a beehive, kind of.
Okay.
And I realized this was something I had suffered, for years, even as a teenager, but I thought I was crazy and couldn't tell anybody about it. And then I was looking up what the treatment was, and basically the treatment is exposure therapy for the most part. And I decided to do self-exposure, which is probably the biggest mistake I could have
Oh my
made.
goodness.
And I went into such a bad mental health state that I couldn't eat for a week. Literally could not eat for a week. And that was the point my husband was like, enough is enough. You need help. And that's when I started going to therapy. Like, I mean, whatever. I found a
Yep.
therapist. That was the point where I started going to therapy and started on my like real mental health journey. At the same time, I think because of the anxiety, I think it affected everything. And I started having like I was bleeding like a lot. Like it was, heavier than normal. It wasn't the IUD because it was fine up
Yep.
until that point. Um, and I just decided like I'm not, I can't keep getting my period like every 3 weeks I'm getting my period. It was just too much. Um, especially as an Orthodox Jewish woman who observes Taras Mishpacha, or family purity, which is you can't have like you can't even touch your husband while you have your period, and for 7 days after. And I was just like, I can't keep doing this where we have maybe a week, where we can touch each other and we're okay. And so I decided, I think I'm okay enough that I can try hormones just to push my period off. But because I had bad experiences with hormones in the past, I was very, very hesitant and I did not take out my IUD. I just kept it in. Um, I started with the NuvaRing and I just used it literally to push my period off. Like I was not following it according to the directions. I was leaving it in for 5 weeks, having a break. And I was doing that for a few months until, so that was probably March. Like April, maybe I started. And then in November, when I saw I was, my mental health wasn't more affected because of it, I said, okay, I want to get something just like get it and forget it kind of thing. So I decided to get the Depo shot. And I got this in November 2020. Um, and that just it's a progesterone only shot, and it's what progesterone only shots do is they thin out the lining so that there's not as much bleeding. Unfortunately for me, it did the complete opposite, which I didn't know at the time, but it like triggered crazy amounts of hemorrhaging. Um, and it was just getting heavier and heavier. Um, uh, and I wasn't sure what to do until this was right around Christmas time.
Okay.
I ended up going to the ER. I had actually gone to the ER 10 days before because I had started experiencing severe right-sided pain. And I just went to the ER to rule out appendicitis. So the reason why this is important is because I had done blood work in the ER. So they had relatively recent blood work. 10 days later, when the hemorrhaging was literally out of control, I went back to the ER and they were like, well, we can only really treat you if we see there's if we see there's an actual like medical, difference. And my hemoglobin had dropped in those 10 days from a 12 to an 8.
Oh, wow. Meaning that's
Yeah.
hemoglobin is an indication of the amount of blood that's in your body
Yeah.
for those of you non-medical
Yeah.
people.
Well,
So yeah.
12 is, 12 is normal. When it goes below 10, it's whatever. At 7, it's time for a blood
Yeah.
transfusion. So, but to go so drastically in 10 days was like crazy. So this was literally Christmas, like December
Yeah.
2020. Um, and it was a crazy, crazy, crazy snowstorm. Like the weather was terrible. I went to an ER right around my house. It was like it's a very like, they don't have, it's like, it's good. It was right around my house, but they needed to transfer me to main campus.
Gosh.
Um,
Oh, oh my gosh.
and they transferred me in an ambulance. And I remember I was in the back of the ambulance and I'm like, I am relatively stable. Please just go as slow as possible. And in the ambulance, we were going like probably 5 to 10 miles an hour. And yeah. So I got to the main ER where they have all the gynecological stuff and they tried to stop the bleeding. And they ended up having to give me a blood transfusion because overnight I went, so low. And I ended up, I was really like not, almost like not able to talk. I couldn't open my
Oh my
eyes.
goodness.
Um, I almost passed out. Like I went to the bathroom and had to pull the cord for help. And they gave me a blood transfusion. They had also given me shots to try and stop the bleeding, and it definitely helped, but it didn't stop. Um, and and after I was discharged, they had made an appointment for the first OBGYN that was available, but it was just a resident because holiday time, they don't, there
Right.
was no room for, and um, at that, um, at that appointment, they were like, okay, we don't have any choice. We're not sure what to do, so we kind of have to take out the IUD. Um, but because it wasn't an American IUD and they couldn't find the string, they didn't want to take it out blind, so they scheduled it for me to come in after the holidays were over, like mid-January. In the meantime, until that happened, I was literally in and out of the ER because they would give me a blood transfusion to get my hemoglobin up and have me do blood work 2 days later, only to see that it had dropped back down again.
Oh my
Um,
goodness.
and it was like I got, I think, 4 blood transfusions until the last time that I did blood work from my GP, not from an OBGYN, not from the ER. And she called me and said, like, enough is enough. We're getting you into emergency surgery. And she got me into emergency surgery. I remember it was 9:30 in the morning and she had called me. Her first words were like, stop eating. And I'm like, well, actually, I haven't actually eaten yet this morning. So she was like, okay, good, we're getting you into surgery. So they got me into surgery that day, where they took out the IUD, but they said also my lining was so, so thick, so they did a DNC. And with that, everybody was so surprised because they're like, I feel like nobody ever heard of a DNC being done if it wasn't for a
Right,
miscarriage. Um, but they did it to like scrape out my lining and hopefully reset my uterus,
right,
so to speak. Um, and you know, it it was so actually they had said that they saw a uterine yeast infection. And once they treated that, like it was like the bleeding stopped, the cramp, like everything stopped. um, for a little bit, um, till about June 2022. And then the bleeding started again. It wasn't as heavy, but it went on, I went to I went to my GP who does gynecology, just at first, and she tried to, send me for an ultrasound, and then I saw it dragged on for about 5 months or 6 months approximately, um, till they decided, okay, we're going to do a hysteroscopy to see what's going on. Um, and when they did the hysteroscopy, they did another DNC just to, again, try and restart my uterus. After my follow-up appointment, I remember going to my OBGYN and saying, like, why is this happening? What's going on? Am I just going to have to every 2 years have to have another DNC? You know, I asked, is it possible that if it's endometriosis? Because at that point I had done a lot of research and realized and had seen that even though endometriosis is usually agonizing pain, it can also be heavy bleeding. And she was like, I don't like in terms of the DNC every 2 years, she's like, I don't know, we'll see, like kind of just like she didn't really know what to answer. Um, and in terms of the endometriosis, she's like, the only way to really diagnose is to do like explore like laparoscopic surgery just, exploratively, and we treat it with birth control, so we're anyhow doing that for you. So so I kind of like left it, but I was really like I felt kind of like she had just brushed me off and not
right.
I even yeah, I she had brushed me off and not really addressed my
Yeah,
concerns.
I
Um
mean, because the question is how long, I mean, could anyone keep going like that? I mean, it's just, it's unfathomable. It's really unfathomable. Um, so, okay, so, I mean, how does this end? Like, what happens?
So what happened was, and then I was fine for a little bit, and then it started again, and then it was never like, okay, I'm just having a little bit of staining, like one day. It might have just been only one day, but it was pretty heavy bleeding. Like it, there was no way even medically it could be called staining. And this went on, and I saw her again, and I actually brought up the topic of a hysterectomy, and she completely brushed me off, and she said no, if what, trying to like, be really really like careful with your birth control, like meaning I was on the NuvaRing, if like every 3 weeks exactly changing it doesn't work, she's like, then there would be other options. She like they were just like, complete like, she was totally like, when I brought up the thought of a hysterectomy, like the idea of a hysterectomy was like, absolutely not. And I was just so, so frustrated at that point because it just felt like it was just never ending. Um, and I ended up, with the help of the Beaker Home of Cleveland, getting a referral for a different OBGYN, and they were able to actually get me in within a couple weeks because, of course, there was like a crazy wait time. Um, and this new OBGYN was amazing in terms of her bedside, her knowledge. So she sent me for an ultrasound, and everything was normal. And she was like, okay, just continue using the birth control as is. And it was okay for you know, another few months. And again, and then last May, again, I was having crazy, crazy bleeding. So I had another ultrasound done. And it was actually done in the endometriosis clinic, not like as a regular ultrasound. And it felt like the longest, most thorough ultrasound I had ever had done. And then when I got the results, it says it looks possibly like something like adenomyosis, which is what they call the ugly sister of endometriosis, but it's localized to the uterus. It's not spread all over. And once I got that once I saw that, and it wasn't definitive. It wasn't like, oh yeah, this is for sure. I was like, okay, I am done. A year before that happened, my husband and I had gone to our Rav, and asked about having a hysterectomy, and he had already been like, just the fact that you're coming here shows where you're at. And he said from a halachic standpoint, like in terms of the Judaism, it's not a problem because, for the most part, permanent birth control is not considered a good option.
For
Um,
you, for you,
hmm?
for you.
No,
Go ahead.
right.
Go-
Yeah. No, for the most part in Judy, like most women won't, get their tubes tied or anything like that because it's a permanent option.
Right.
But for me, I was told, he basically said, I'm not making a medical decision for you, but in terms from, but other than that, yeah, you have the go ahead.
Because and I'm guessing that he said like and the way he said it, the fact that you're asking me means that you're tremendously suffering, and that like there needs to be some kind of a solution because you've been through so much.
Right. We literally said we feel like roommates at this point. Like we're just not, there's no, um, so once I had that diagnosis, I made an appointment for the doctor. Like I literally made an appointment for the first OBGYN that I could get, not my regular OBGYN because and even before the appointment, I was like, okay, no matter what it takes, I am standing up for myself. I do not want to try another form of birth control. I do not I'm done. Like now that I know it's, not just a matter of time. Um, so I walked in and I advocated for myself. I explained my whole history. I said, I do not want to keep trying forms of birth control for it to only work for a few months. I'm done. And he agreed with me that it makes sense.
Aya, from uh, when I'm curious about once you did have the hysterectomy, like what and even in the like the the time period beforehand, as you were sharing with people, your parents, and sharing with people what you were planning and what you were going through, what did people say?
I wasn't really sharing with people. I felt like people would like judge me. So I wasn't, I like even my parents, it wasn't like I was like, I wasn't telling them all the time. It did take this was like in June. It took me like I ended up having to switch not just doctors but like hospital systems because of insurance. So it took time. Once I actually had it made the decision and had it scheduled, like after my surgical consult with my actual OBGYN that, the surgeon that did the surgery. So that's when I told my mother, and told a few people. I really wasn't open about it. And the people that I did tell who had known what I was going through, were very, very supportive and very like encouraging and empathetic towards it, and totally understood. Think they felt also bad that this was my only
Right,
solution.
right. After all of that. And you wrote this poem that you shared with me and that we shared with the I Was Supposed to Have a Baby community about the mixed emotions of having a hysterectomy and what that would mean for you, both positively and what that would mean for you negatively. Can you share a little bit more about that now?
Yeah. So once I was post hysterectomy, um, I felt like a new person. Like a lot of issues that I was having that I thought I didn't dream were connected to that were all of a sudden like just went away, disappeared. Like I had a ton of digestive issues and stomach pains, and I even had like right lower pelvic pain that I thought was, related to like my reproductive system, that when I would do ultrasounds and they would say nothing, they're like, oh, it's probably gastro related. You need to see a gastroenterologist, which I had been seeing since age 18, trying to figure out what's going on. It just completely disappeared.
Wow.
I felt like like the amount of like my mental health since then has like gotten to a much, much better place. And I literally felt so much better after, like even a week after than I had felt before. I have so much more energy now.
Wow.
Just overall, like there's so many things. So I was like, oh, and then I got the confirmation from pathology that yes, it was adenomyosis. And not only that, but like I'm putting it in layman's terms, but basically my uterus itself wasn't functional. And that like cemented my decision and made me realize like I 1,000% made the right decision. But the fact is that I can't have any more kids. Like I have two kids. Um, I used to say I only have two kids, and I said once I had the hysterectomy, I kind of said I need to switch my perspective and say I have two kids. I, have to, focus on what I do have. And it's not always easy. Like, going out and seeing all my neighbors who are, you know, all either just had a baby or pregnant, it hurts. It does. And it's something that I'll probably be grieving for the rest of my life. Um, but I don't regret what I did. I did what I had to do to have quality of life, to, in every way, shape, and form.
A 1,000%. 1,000%. And I want to be clear here to the audience. Chaya approached me. Chaya reached out and said, I have a story and I want to share. I'm curious why you said that. Why are you here today? Why did you feel that you wanted to share this story?
So, I will say before I had the surgery, like, I didn't even tell my siblings. Like, they knew I was having surgery, but they didn't know why. I wasn't open about it because I was kind of like, I'm gonna be judged. I'm gonna, So there was that aspect that people wouldn't understand that I would be judged. I was feeling so alone and having like no support because even people who have had a hysterectomy, that I've heard of. I don't even know anybody personally, but that I've heard of were an emergency hysterectomy. They didn't get to so-called choose. Like I chose to have it. I didn't really have any
Of
other
course.
options, but I was able to prepare for it and make the decision to it. And I was just like, I feel so alone and like I don't have support, and if I could just even, help other other women, who are going through a similar thing, not be so alone, and also be okay being an advocate and standing up for themselves, regardless of what social and community pressure is to have however many kids, um, and people not really understanding or giving support.
Oh, you are a tremendous, tremendous light for people, all kinds of people, whether, they have your specific diagnosis or not, but you are a tremendous light for people, for for anyone who is going through some kind of mystery in their life, some kind of medical mystery, and trying to push and advocate and say, like, no, I need this, no, you need to check me again, no, I don't want to do this anymore, no, I'm tired, no, I need fill in the blank. I think that there is so much to learn from you, and you sharing your story about that piece, and also about the the whole mental health component, that lots of people have difficulty in in terms of, like, struggling, whether it's, dealing with specific fertility challenges, or just struggling in pregnancy, or whether they have an underlying mental illness or not, that people struggle with mental health, and that also is another thing that people don't talk about very much, and can also prevent people from having as many children as they want. And so the fact also that you're so open about that piece, in addition to the medical piece, all the medical pieces that you went through, is so important and so powerful for people to hear.
I'm not sure what I'm supposed to say to it, but I do know that suffering from mental health and depression and anxiety, and really growing and becoming a much stronger person than I used to be, um, I, you I think it helped me in this aspect as well, and helped me, be so open about it. Um, I even like discussed with my therapist about people who talk about going back to the way that, like coming back
Yeah.
to themselves.
Yeah.
And I said, I don't want to do that. I don't want to go back. Like, I don't like who I was 10 years ago. I like who I am now. I grew, and I'm, people are like, you're so strong. And I'm like, I didn't have a choice in the matter. I wouldn't have chosen it. But once it happened, yes, I am strong. And I'm hoping, from my place where I am now, to, help strengthen other women in that aspect, and, you know, be a support for,
For all of them,
yeah.
for all of them. Um, and so, in closing here, what is your message to the people out there who, are either struggling with HG, the people who are struggling with depression or anxiety, the people who are not sure what's going on with their body, whether it's bleeding or periods, or just not understanding why they're not getting pregnant, or dealing with unknown medical phenomenon that, like, their body is just doing things and people can't figure it out. To all of those, you've been through so many different pieces in your life so far, and you've had to overcome all of it. What is your message to anyone out there who is going through something?
My message is, first of all, find support. Um, don't keep, I mean, maybe don't be like completely open if you're not comfortable, but if it takes more energy to hide things than it does to get the support that you need. And don't be afraid to advocate for yourself. You know, get a second opinion, switch doctors. Don't let anybody gaslight you just because, um, they went to medical school and you didn't. The internet's out there, and has all this information that can be used to our advantage as a patient.
Absolutely.
Not to say you should diagnose yourself and not listen to your doctor, but tell the doctor, say, I've looked up online
Yeah.
and can it be this? What can I do to find out? Like, advocate for yourself.
Absolutely. Absolutely. Yes, like, everybody always says like, don't Google your symptoms because you'll diagnose yourself and then you'll make yourself more scared and blah blah blah. So the reality is that there's, as with all things, there's, it's a two-sided coin. Yes, all this information is out there, and yes, you could freak yourself out and think that you have something absolutely awful, but it also can arm you with information to then bring to your doctor and say, well, what about this? And why aren't we considering this? And then let the person who has more knowledge tell you one way or another, that's interesting, or no, the reason, whatever it is, I don't think so. Arm yourself, advocate for yourself. I love that. I love that.
Yeah,
Um,
and even if the doctor says, I don't think so, and is just because brushing you off because they don't want to hear what you have to say, get yourself a second opinion.
Definitely. Definitely. Yes, I'm a huge advocate of second opinions. And then if you have two opinions and they both are very different, then that means you need a third opinion
Yeah,
because you need someone to, you know, have the tiebreaker there. Um, Chaya, thank you so much for being here tonight, for sharing your story so openly, honestly, beautifully, and really just with so much love and frankness about things that you've experienced. And I know because you want to help others. That's what all of this came about, how this came about. Um, can people reach out to you by
yeah,
Instagram? Can they find you if
yeah.
they want to speak?
Instagram probably not so much because my account is on private. Um, you can try. I will, I'm like, depending on what your account looks like. If your account is private, most likely, unless I know who you are, I'm not going to let you like follow me. Um, but you can always also email me, or that would, like, I'm much more likely to, look at an email and see that it's from an actual person and not just random.
We will share her email in the show notes, both here and when this is put up on our podcast. Chaya, thank you so, so much. Again, we are just the I was supposed to have a baby community. We are all so grateful to you. So grateful. Thank you.
You're welcome.
Okay. Good night, everybody.